Good afternoon. Thank you for joining us for FYSB's Adolescent Pregnancy Prevention Program, Personal Responsibility Education Innovative Strategies, or PREIS Program Pre-Application Webinar. I'm going to turn it over to Jessica Johnson, a Project Officer with the Family and Youth Services Bureau.
Welcome to the pre-application webinar for the Personal Responsibility Education Innovative Strategies program. Throughout the webinar, the program will be referred to as PREIS. Please be aware that we will not accept questions during this presentation. For additional questions, please contact the persons listed in the PREIS Funding Opportunity Announcement. For your convenience, this contact information is also provided at the end of this webinar. The purpose of this webinar is to review the requirements and evaluation criteria of the PREIS Funding Opportunity Announcement, also known as the FOA. A recording of this webinar will be posted on the ACF website at least 30 days prior to the application due date, which is June 27, 2016. Please be advised that ACF does not provide direct guidance or instruction in the development of an applicant's project design or in writing their application. Applicants should use their best judgment in determining whether they are able to meet the requirements contained in the FOA, whether they are able to develop an application they believe to be responsive to the FOA, and in designing and writing their applications. Applications will be reviewed and evaluated by objective review panels using criteria described in Section 5.1 of the FOA. The review panels will use the FOA as their principal guidance available to them in the same way that it is the principal guidance for applicants. The agenda for the webinar today is to introduce key speakers, provide an overview of ACYF and FYSB, and provide an overview of the PREIS FOA. For the purposes of this webinar, we will focus on key information about the program, the evaluation criteria, and application submission instructions. We expect applicants to conduct a thorough review of all of the details in the FOA. I am Jessica Johnson, a Project Officer in the Adolescent Pregnancy Prevention Program in the Family and Youth Services Bureau. I serve as co-drafter of the PREIS FOA, along with Atish Bailey, who is unable to participate in today's webinar. Also presenting is Seth Chamberlain, a Senior Social Science Research Analyst with the ACF Office of Planning, Research, and Evaluation. The Adolescent Pregnancy Prevention Program is part of the Family and Youth Services Bureau, commonly referred to as FYSB. FYSB is a part of the Administration on Children, Youth, and Families, ACYF, and ACYF is housed within the Administration on Children and Families within the U.S. Department of Health and Human Services. ACYF administers the major federal programs that support social services, protective services and shelter, and adoption for children, youth, and their families. These programs administer funding and support to provide services, carry out research and demonstration activities, and undertake training, technical assistance, and information dissemination. FYSB's mission is to support the organizations and communities that work every day to put an end to youth homelessness, adolescent pregnancy, and domestic violence. FYSB's vision is a future in which all of our nation's youth, individuals, and families, no matter what challenges they may face, can live healthy, productive, and violence-free lives. FYSB consists of the Runaway and Homeless Youth Program, the Family Violence and Prevention Services Program, and the Adolescent Pregnancy Prevention Program. FYSB provides national leadership on youth and family issues. FYSB also promotes positive outcomes for children, youth, and families by supporting a wide range of comprehensive services and collaboration at the local, tribal, state, and national levels. I will now provide an overview of the PREIS FOA. Section 2 of the FOA outlines federal award information. PREIS is a cooperative agreement. We are expecting to award up to 13 applications for a total of $11.9 million. The minimum award amount is $550,000 per budget period, and the maximum award amount is $975,000. PREIS is a 60-month project with 5 12-month budget periods. Section 3 of the FOA includes eligibility information. All of the organizations listed on this slide and the next slide are eligible to apply for PREIS. These organizations include state, county, city or township, and special district governments, Native American tribal governments, independent, local, and regional school districts, public and state-controlled institutions, and private institutions of higher education. Also eligible to apply are public housing authorities, Indian housing authorities, nonprofits having and without 501c3 status with the IRS, for-profit institutions other than small businesses, local affiliates of national organizations, and small businesses. Section 1 of the FOA describes the PREIS program and outlines the expectations of the program. PREIS is one of 4 funding streams under the Personal Responsibility Education Program, otherwise known as PREP. PREP was authorized and funded by the Social Security Act, and the Patient Protection and Affordable Care Act of 2010 established PREP. The program was initially funded from 2010 to 2014 and was later extended through 2017 by the Medicare Access and Children's Health Insurance Program Reauthorization Act. The law specifically specifies that PREIS is to be administered by the Department of Health and Human Services to award grants to entities to implement innovative youth pregnancy prevention strategies, target services to high-risk, vulnerable, and culturally underrepresented populations, and participate in a rigorous federal evaluation of the activities carried out with grant funds. The purpose of the PREIS program is to build the evidence base for adolescent pregnancy prevention interventions that are effective with high-risk and vulnerable youth populations and fill gaps with new promising program models. The goal of the PREIS program is to reduce pregnancies, births, and STIs, including HIV/AIDS, among high-risk youth populations. The objectives of the program are to target those youth populations that are at the highest risk for teen pregnancy, to prevent adolescent pregnancy and STIs, including HIV/AIDS, to rigorously evaluate the interventions using a Quas Experimental Design or a randomized control trial, to manualize and package the curriculum, and to disseminate lessons learned, best practices, and relevant findings. PREIS is designed to serve youth ages 10 to 19. Programs that target pregnant and parenting adolescents can serve youth up to 21 years old. In addition to youth who reside in areas with high birth rates for youth, the target populations included in the PREIS legislation also include culturally underrepresented youth populations, youth in foster care, runaway and homeless youth, youth with HIV/AIDS, pregnant women under the age of 21, and mothers who are under the age of 21, youth residing in areas with high teen birth rates. Target populations may also include youth involved in the juvenile justice system, rural youth, out-of-school youth, fathers who are under the age of 21, youth who are at risk of being or have been trafficked, and lesbian, gay, bisexual, transgendered, and questioning youth. All PREIS programs must consider the needs of LGBTQ youth, must be inclusive and non-stigmatizing, and must be welcoming and equitable. Now I'll review the requirements related to program design. Innovations are new products, programs, ideas, or practices that are tailored to the target population for specific outcomes. Proposed interventions must have relevant process evaluation findings and promising evidence of effectiveness or impact. Proposed interventions must not have been previously rigorously evaluated. Curricula on the Department of Health and Human Services Teen Pregnancy Prevention Evidence Review are not eligible interventions. At least 3 out of the 6 adult preparation subjects must be addressed. These subjects include healthy relationships, adolescent development, financial literacy, parent-child communication, educational and career success, and healthy life skills. Topics must be tailored and developed in appropriate ways to reflect the cultural, linguistic, and regional practices of the target population. Programs are expected to follow the principles of trauma-informed care. Trauma-informed care should take into account the trauma and mental health needs of youth and the factors that improve basic psychosocial functioning. Additional guidance can be found in the link, which is also included as a reference website in Section 8 of the FOA. PREIS programs must provide medically accurate information, including up-to-date contraceptive information and age-appropriate information and activities. Medically accurate and complete means verified or supported by the weight of research or compromise of information that professional organizations and agencies with relevant expertise in the field recognize as accurate, objective, and complete. Programs will be expected to document the appropriate sources for abstinence contraceptives, STIs, and/or HIV in all program materials. Topics, messages, and teaching methods must be suitable to the cognitive, emotional, and behavioral development of the age group. Programs must provide referrals to providers of healthcare services as needed. Programs can use PREIS funds to screen and refer youth to services. However, the health services themselves cannot be paid for with PREIS funds. CPP-related healthcare services may include substance use, family planning, mental health, and intimate partner violence services. Programs are also encouraged to enroll youth in health assistance programs such as Medicaid and CHIP, and develop partnerships to help with facilitating and tracking. Phase 1 of the PREIS project will focus on planning activities that must be completed within 9 months of the grant award. These activities include developing and revising the curricula or training materials, having all intervention materials reviewed for medical accuracy and age appropriateness, training staff to deliver the intervention, developing fidelity monitoring tools, documenting the innovative strategy or approach chosen, including program implementation and service delivery. These activities also include receiving institutional review board approval, finalizing memoranda of understanding with partners, developing data collection instruments and protocols, developing and finalizing evaluation plans, recruiting implementation sites and youth participants, finalizing and pilot testing the intervention and all materials related to program implementation, and developing a sustainability plan. Phase 2 focuses on implementation of the intervention and evaluation activities. These activities include obtaining consent and assent forms from parents and participants for the program and the evaluation, implementing the intervention and control or comparison group activities, conducting fidelity monitoring and supervision activities, conducting retention, tracking, and follow-up activities, collecting performance measures and evaluation data, and disseminating findings through presentations. Phase 3 focuses on data management, analysis, and reporting, packaging, and dissemination. These activities include continuing implementation of the intervention with control and comparison groups, analyzing outcome evaluation data, submitting a final evaluation report to ACF for review, manualizing and packaging the curriculum and materials, expanding sustainability activities, submitting manuscripts to peer-reviewed journals, submitting final evaluation findings to the Health and Human Services Teen Pregnancy Evidence Review, and disseminating information related to program design, theory of change, implementation, and any early. I will now turn the presentation over to Mr. Seth Chamberlain.
Thanks, Jessica. So I'm going to speak about rigorous evaluation expectations for this next round of PREIS grants. All grantees are required to propose a rigorous evaluation. One of two study designs is acceptable. A randomized control trial, i.e. a random assignment control trial. This requires random assignment either to a treatment group or to a control group, or a high-quality quasi-experimental design. In a quasi-experimental design, no random assignment is conducted, but folks are still assigned to a treatment or to a comparison group. Both designs require a treatment group that is eligible to receive the full intervention and a control or comparison group that will receive an alternative to the intervention or no intervention at all. Projects are required to meet the Health and Human Services Teen Pregnancy Prevention Evidence Review criteria for rigorous design. Rigorous evaluations are also required to have evaluation questions. In fact, they are required to have both primary and secondary evaluation questions. Primary evaluation questions address quantitative outcomes related to, at a minimum, behaviors related to reductions in sexual risk-taking, teen pregnancy, or sexually transmitted infections. Secondary evaluation questions are of interest to the applicant and are related to the primary evaluation activities. These include qualitative research related to sexual risk-taking, program implementation, or program activities, other risk behaviors that co-occur with sexual risk-taking, risks that are specific to a target population, adulthood preparation subjects, and the strength or unique components of the program. With regard to the methodology, for rigorous evaluation, they should collect data at no more than four time points. These include the baseline, immediate post-intervention, a short-term follow-up up to 6 months post-intervention, and a long-term follow-up up to 9 months post-intervention. Programs with pregnancy birth rate outcomes are also expected to have more extended short and long-term follow-ups, for example, 12, 18, or 24 months. Applicants can propose a design outside of these guidelines with strong justification. With regard to administering and managing rigorous evaluation, grantees are expected to have experience in doing so in administering and managing program implementation and evaluation projects. This includes significant knowledge, education, and/or experience in program development, program implementation, and program evaluation. Experience supervising the implementation of a rigorous evaluation, understanding of confidentiality and privacy of data protections, experience supervising the collection and reporting of performance measure data and use of performance measures for continuous quality improvement, and capacity and experience with recruiting, enrolling, retaining, and tracking the number of participants. Rigorous evaluations must be conducted by an independent third-party evaluator. Internal evaluators are not permitted. And at least 20% of the budget must be for evaluation purposes. I'll turn it back to Jessica.
Thank you, Seth. Section 1 of the PREIS FOA also includes post-award requirements. In addition to those post-award requirements listed in this section, PREIS has specific requirements related to the medical accuracy review, performance measures, and rigorous evaluation. PREIS programs must submit all materials to FYSB during Phase 1 for formal medical accuracy review. Programs will be expected to obtain approval and finalize all program materials prior to use and prior to the beginning of Phase 2, the implementation period. Changes after final approval will not be permitted. For performance measures, they are also a post-award requirement. The purpose of performance measures is to support program monitoring, improvement, and reporting. Performance measures are not used to determine effectiveness or impact. FYSB uses one set of performance measures for all PrEP programs. Programs must report performance measures on a semi-annual basis and ensure that all staff involved in the collection, management, and reporting of these performance measures are adequately trained. The current set of PrEP performance measures is being revised. FYSB will be seeking OMB approval. OMB stands for the Office of Management and Budget, for information collection under the Paperwork Reduction Act for the PrEP performance measures. FYSB plans to release these revised performance measures along with the data collection instrument approximately 90 days after grants are awarded. Categories of performance measures that are currently collected include structure, cost, and support, participant characteristics, perceptions of program experiences, and perceptions of program effects, and measures of attendance, reach, and dosage. As already shared, the PREIS program is being implemented in 3 phases. Evaluation activities in phase 1 of the program are related to refining and improving the evaluation plan and obtaining IRB approval. Activities in phase 2 of the program are related to evaluation implementation. And activities in phase 3 of the program are related to data analysis, reporting, and dissemination. Section 4 of the FOA is the project description. The project description outlines what you should include in your description of your project. For the purposes of this webinar, we are only going to review the evaluation-related sections under Section 4. We strongly encourage you to review all of Section 4 now.
So, with regard to the Program Performance Evaluation Plan, this section basically means performance measures. This is again in Section 4.2. So applicants must describe the plan for program performance evaluation. This plan should monitor ongoing processes and progress towards goals and objectives of the project. It should include descriptions of the inputs, key processes, expected outcomes of the funded activities. Should be supported by a logic model and explain how inputs, processes, and outcomes will be measured. It should describe systems and processes that will support the organization's performance management requirements through effective tracking of performance outcomes. It should describe any potential obstacles and how those obstacles will be addressed. It should specify how the collection of performance outcome data incorporates the specific PREP performance measures that Jessica just talked about, and it should include a plan to monitor program delivery and fidelity. The Funded Activities Evaluation Plan basically means rigorous evaluation. So, as I discussed before, applicants must propose primary and secondary research questions. They must propose a rigorous design that describes treatment and control or comparison conditions, timing or schedule of programming and data collection for all time points, eligibility and screening criteria, the unit of assignment and procedures for assigning participants, and anticipated challenges and proposed solutions. Applicants must also address methodology. This includes the participants, recruitment and enrollment strategies, including a strong plan for how to obtain adequate sample sizes that support statistical power to detect impacts. The methodology must describe consenting procedures, data collection procedures and methods used to collect data, instruments and measures used to assess the variables of interest, and measures used to protect confidentiality and privacy. Applicants must also address IRB approval, that's Institutional Review Board approval and consenting procedures, Applicants must propose practical and reasonable solutions to addressing challenges. At least one challenge of the following must be discussed: the evaluation design or assignment, recruitment, retention and tracking, and analysis. Applicants must address the plan for how participants will be tracked and retained. Applicants must address data management, that is, procedures for data entry, data verification, and data cleaning. And applicants must address data analysis, that is, baseline equivalence, the sampling technique, power analysis that includes an estimate of the effect size per the sample size, and proposed statistical analysis. Turn it back to Jessica to talk about section 5.1.
Thank you, Seth. The criteria that will be used to review and evaluate applications is included in section 5.1 of the FOA. All applicants should thoroughly review the evaluation criteria as stated in the Funding Opportunity Announcement. This slide outlines the evaluation criteria sections and the point value associated with each section. Please also note that each section and each individual criteria has a point value. The objectives, outcomes, and need for assistance section is worth 18 points. The approach section is worth 27 points. The organizational profile section is worth 20 points. The program performance evaluation section is worth 8 points. The rigorous evaluation plan is worth 22 points. And the budget and budget justification section is worth 5 points. Reviewers will consider criteria related to the need for the proposed project and relevant teen pregnancy prevention and our birth data, objectives of the project and how these objectives align with the overall objectives of the PREIS program, the geographic areas to be served by the program, and key socioeconomic and demographic characteristics of the target community, the target population, the rationale for selecting the population, and a description of what makes the target population at high risk of pregnancy, an estimate of the overall program participants expected to participate in each year of the project, outcomes expected for the proposed project, and the logic model. Reviewers will also consider criteria related to the timeline for conducting the proposed activities, rationale for the selection of the intervention, including the theoretical framework, findings from previous studies of the intervention that demonstrate promising evidence of effectiveness, the rationale for why the proposed approach is innovative, and how it fills a gap in teen pregnancy prevention research, the rationale for the selection and details on how the 3 adulthood preparation subjects will be incorporated into the program, and mechanisms that will be used to deliver the services. Reviewers will also consider criteria related to the identification of sexual risk and protective factors, a plan for ensuring that all program materials used are medically accurate and age appropriate, methods to ensure facilitators and educators who deliver the program are formally trained in the model, and how follow-up technical assistance will be provided, a dissemination plan for program evaluation outcomes, a strategy for sustainability, and a strategy for how referrals to other health services will be made and tracked. Reviewers will consider criteria related to the experience and expertise of the organization in providing teen pregnancy, STI, or HIV/AIDS prevention services, experience and expertise of the organization in working with vulnerable, high-risk youth populations, the ability and expertise of the proposed project director or principal investigator, key staff, and partnering organizations to carry out the program and evaluation activities, the experience of the project director or the principal investigator in supervising and managing the implementation of rigorous evaluation studies and in conducting continuous quality improvement activities, documentation of the roles, responsibilities, and time commitments of each proposed project staff, including consultants, subcontractors, and partners, the strategy for managing and maintaining any partners and partnership agreements, and the description of fiscal and accounting procedures. Reviewers will consider criteria related to the applicant's capacity to collect, aggregate, and submit performance measures on a semi-annual basis, the data collection strategy for performance measures, and the fidelity monitoring plan to ensure that the program model is being implemented as designed. Reviewers will consider criteria related to the plan for program implementation and delivery, primary and secondary evaluation questions, evaluation design, the methodology, the data management plans and procedures, the analysis plan, and anticipated challenges with the rigorous evaluation. Reviewers will consider criteria related to the budget that provides details on the itemized expenses, a budget that demonstrates how cost estimates were derived, a budget that includes at least 20% for funds for evaluation, and a budget that includes funds to support attendance at the grantee meeting and topical training. Section 4 of the FOA includes information on how to apply and submit your application. The deadline for electronic application submission is Monday, June 27, 2016 at 11:59 p.m. Eastern Time. Electronic applications submitted to grants.gov after 11:59 p.m. Eastern Time, as indicated by a dated and time-stamped email from grants.gov, will be disqualified from competitive review and from funding under this announcement. The application submission, which includes the project description and appendices, is limited to 110 pages. The project description includes all of the following listed on the slide: the table of contents, the abstract, objectives, outcomes, and needs for assistance, the approach, the program performance evaluation plan, the funded activities evaluation plan, organizational capacity, logic model, project sustainability plan, and the line item budget and budget justification. The appendices must include, but is not limited to, the following: staff resumes, third-party agreements and MOUs, letters of support, certifications and assurances, proof of legal status if applicable, indirect cost rate letter if applicable, the PREIS assurances form, and the LGBTQ accessibility policy form. Other forms that are required for submission includes the certification regarding lobbying, the SF-424A budget information, the SF-424B assurances, the SF-LLL disclosure of lobbying activities, the SFP or PSL, the project performance site locations, and the protection of human subjects assurance identification, your IRB certification. In Section 8 of the FOA, there is a list of several websites that could be used as resources to respond to this funding opportunity. In addition to the Adolescent Pregnancy Prevention Program, we recommend viewing the PrEP evaluation website. The National Clearinghouse on Families and Youth website includes resources tailored to all of FYSB's programs. The current set of PrEP performance measures are posted on the PrEP Performance Measures website. For questions related to grants.gov, please email support@grants.gov or call 1-800-518-4726 or 1-800-518-GRANT. For questions related to application submission, please contact the FYSB Operations Center. For additional questions about the FOA, please contact me at jessica.johnson@acf.hhs.gov. Thank you for taking the time to attend the PREIS pre-application webinar. As we mentioned previously, we will not be taking questions. Thank you so much for joining us, and have an